Ready? Clap. Oh! That was a gator chop, I think. Well, joining me for this edition of Discover the Joy, the Purdy podcast, is Paris Richardson. She currently holds the title of Miss University of Florida.
Miss Gainesville.
Oh, excuse me,
sorry.
Miss Gainesville. Yes, okay, Miss Gainesville. And then in July, you're going to be competing for Miss Florida.
Yes.
Thank you so much for, oh my goodness. She also has a bachelor's degree in public health, and this spring she's going to be awarded her master's degree in health administration. That's coming up next month.
Yes.
Congratulations.
Thank you so much.
I know that's like really taxing and a lot of focus, but you are kind of all over the place with creating community organizations and your masters and the cheerleading, and I don't know how you do it all. So I'm kind of excited to start talking about, well, first of all, you have a platform with you're running for the title of Miss Florida.
Yes.
Tell me about this. It's called Crown of Health. Mm-hmm. And I see a pattern here.
I do love health. So I was able to get my degree in public health. Starting at the University of Florida. I've been passionate about healthcare since I was a little girl. I was the little kid at 7 years old looking up med schools to go to on my iPad, and it's kind of gone on, and I've been able to shadow, gain experience, and learn that I didn't necessarily want to be a doctor or a physician, but I still want to go into healthcare. I was able to organize a club in high school called Ribault Get Raw, where I was able to learn more about advocacy and healthcare administration, and now I'm going to get my healthcare administration degree, and I've been able to implement Crown of Health in my community in Gainesville and Jacksonville as well.
All right, we're starting from the beginning. 7 years old, you said?
Yes.
Where does that come from? Do you have doctors in your family? Do you have nurses? Why?
I don't know. I've always been an ambitious kid. I've always been one to kind of step out and try and find my own path. I think that's something I think a lot of my family members would agree with. And I knew from a young age that I wanted to be successful, and I knew being a doctor was prestigious and I would make good money and be able to take care of other people. So that was the career that I wanted to take on. It was my dream to be an OBGYN.
Really?
Yes.
But you are not doing that right now.
No,
and how did you figure out that that's not what you wanted to do?
Lots of experience, lots of shadowing. I had a great family support system who always put me in positions to learn what I did versus what I didn't want to do. So I'm very grateful for that, to know that I didn't have to go through 12 years of school to learn that that's not really what I wanted to do in the end, and I'm still able to help people through health administration.
Okay, and so when you got into these situations of interning and shadowing and stuff, what was it? Was it like blood? Was it I just don't want to, what was it that kind of?
A big part was definitely schooling. Mm-hmm. Going to school for so long played a big part, having to go to residency, get a fellowship.
It is a long time.
It's a long time, even after med school. It's a big commitment. Mm-hmm. Also, seeing the work-life balance that a lot of doctors had, wasn't very interested in that. Yeah. Someone who wants to have a family and be a mother, it didn't seem like it would align with what I wanted to do in the future.
Which makes total sense.
Mm-hmm.
So you picked administration. So in my mind, I'm thinking, there's Paris going to be in this tower and she's going to be the boss and we are never going to see her again. But talking with you, that's not your vision.
No, not at all. I want to continue to use Crown of Health as a platform, as a jumping spot for me, especially when I get into healthcare administration, continuing to build programs for health equity, making sure we can dismantle health disparity barriers for our communities, and I want to use that as a healthcare administrator. I know I'll be able to continue to still go out in the community and use my role to touch more people.
So tell me about Crown of Health. What exactly is that?
So Crown of Health stands for Community Research Outreach Wellness and Nutrition. Mm-hmm. It's more of a whole wellness approach instead of looking at medicine, going to the doctor. I want to focus on preventative medicine, essentially. How do people stay healthy without having to come to the doctor or a healthcare administrator? I prefer not to see you.
Yeah.
I don't want you to come to my hospital. I want you to be healthy and at home. So Crown of Health kind of helps tackle some of that stuff, making sure people know that the resources they have in their communities, how to stay healthy, how to avoid getting high blood pressure, hypertension, high blood sugar, all these chronic illnesses that a lot of people in our communities are currently dealing with.
Now, why do you care so much about other people's health?
I don't know. I it's kind of two things.
Yeah.
One is as someone who's passionate about health administration and advocacy, it helps us. Helping other people's health care helps us. We are less susceptible to chronic illnesses. We're less susceptible to the flu if everyone's getting their flu shots or COVID vaccines. But also, as someone who wants to be a healthcare administrator, if we're able to lower these costs, it's going to make my job a lot easier in the future. If we can focus on these upstream factors and upstream determinants and helping people understand that they can help themselves before we have to help them, it'll make a huge difference.
Now, how old are you? Do you mind me asking?
23.
23. How do I get my daughters to be like you? Where does this come from? You had a really great support system.
Absolutely. My parents definitely, and my grandparents instilled hard work into me from a young age, showing me that with hard work comes great outcomes. There's consequences to all actions. There's some things that I always live by, and I think were really instilled into me at a young age, knowing that I wanted to be successful, and you have to put hard work in to be successful.
So like hard work, like did you have chores? Did you, like, what kind of things would you say that you worked through or, really had to stick with? Because as a kid, I would imagine kids like to quit.
Oh, no, there's no quitting.
My kids are always like, do we have to finish this? Yes,
Yeah.
You started it. So tell me about some of these things that you were taught.
Absolutely. I definitely was not allowed to quit. That was a big thing in our family. Like you said, if you start something, you finish it. I've been cheering since I was 6 years old. So
Cheerleading? Oh,
cheerleading and
okay.
dancing since I was 6. I'm now a UF cheerleader. So I've gone through that for 16, 17 years at this point. And that's something that I've stuck by and I've gained so much from. And that's really, I think, where I've learned a lot about hard work, putting in the time, going extra hours in the gym, whether that's for tumbling or stunting, brushing up on things that I'm not as well as my teammates might be, to help me kind of stand out and level up, go through the levels and the ropes. I've been able to go to so many amazing competitions. I was at the national championship with the Gators this weekend.
Oh my
goodness. If I didn't put the time in at 6, 12, 15, I would not be able to be here. And I think that's a testament to hard work and continuing to do good work and what you love.
Yeah, was that fun or what?
Oh
How was
my
that from your vantage point? You were basically on the sideline of the national championship game there in San Antonio. How was that?
That was so much fun. So much fun. I did not think I was going to be able to come to UF and leave with a national championship under my belt. I've wanted to be a Gator since I was a little girl. When I was looking up med schools, UF was the med school that I wanted to go to. So it's been a dream to be a Gator. I don't remember 06, 07, but I've heard a lot about it, and I've always wanted to have that experience.
The championship.
Yes, the back-to-back football, basketball. I've always wanted to experience that. So I'm so happy before I left, I was able to see at least one.
So when you're out there on the sidelines, do you forget to cheer because you're so focused on the game? How does that feel?
And I would say in a regular season game, there's moments you have homework you're thinking about, so I might space out here and there. But at the national championship, you're like, oh my gosh, come on, God, please, please. I'm down there on the court praying, cover these boys. I'm begging you, put my sign down. The last 20 seconds, I'm looking locked in, and I'll look at the clock, and then looking at the ball, and look at the clock, oh my gosh, and then we won. And it was amazing.
I think the entire country was doing that, looking at the clock, looking at the play, and it was great. And so, but going back, and you talked about sticking with things, you didn't just stick with them, you started things at your school. At your high school, you mentioned a club, a health club that you started. What did you call it?
Ribault Get Raw, which stands for Ribault Get Access and Wellness.
Okay, so you went to Ribault High.
Yes.
And what was this group that you started in high school? Because what kids are interested really in, unless you're really into chess or band or something, you're just a club and you're starting a club. What was this and what was the response?
So I definitely wanted to gain experience from healthcare. As I mentioned, I tried to get as many internships. I think I had almost an internship every year, or some kind of shadowing experience every year. And I was able to connect with our head pediatrician at our school-based health center. I think his name was Dr. Owen at the time. He's gone now, or
Oh.
yes, but
Okay.
We started the club together, and it wasn't successful. The following year, our principal came to me and said that he wanted to get it started again. Let's try again. So it was me and 6 of my classmates that I was able to reach out to come downstairs with me to my principal's office, and we started Ribault Get Raw. And so it's able to promote our school-based health center. It was able to help so many people in our community who didn't have health insurance or didn't have access to care outside of normal business hours.
So did you have care like right there? Like students could go in and
at any time
see a nurse or doctor?
Nurse practitioner at any time.
Really?
You can get vaccinations. You could get, if you needed a physical for school, which a lot of students need. Well, mom can't take me after school because she has work and she gets off at 5 and the doctor's office closes at 4:30.
Yeah.
So you're able to go to the school-based health center. You're still able to stay in your community, work. You're able to promote it to other students. We had health fairs. We were able to get so many students involved, and now it's like a prestigious club at Ribault, which is bigger than we ever dreamed when we created. It was something for us to just kind of gain exposure to healthcare. We didn't have any clubs at Ribault for students who wanted to be pre-med, and now this is an avenue for so many students at my high school, which is amazing legacy that I'm so happy I was able to leave.
That is, and I see you're just lighting up
Yes,
talking about it.
I love talking about it.
But this is something interesting. You said you tried it, and what year was that you tried it?
My sophomore year.
Sophomore year, and it didn't work. So, you know, kids might be hearing this and they're like, yeah, I'm gonna go out and do this. And if they hit a wall or fall flat, how did that feel for you? Like that rejection, and what did it look like? Like, were people just not coming?
People weren't coming.
Really?
No one. We really couldn't get anyone to buy in to what we were doing. What are you doing? I think it kind of taught me more about marketing in itself as well, how to market to my classmates, why this is important, why we need to continue to promote it, why you should get involved with Get Raw, why you need to use these resources, because if we don't, they're going to be gone. So I think that in itself has taught me a lot, and it's something that I've been able to use now as a healthcare intern. I do a lot of marketing. That's what I love doing. And it's taught me how to speak the language of people you're trying to reach, especially with getting a degree in public health and learning how to tell people about health issues that are going on and how to get involved with their healthcare.
So how did you come back from that? You're there, nobody's coming, you got to shut her down. So then how do you get motivated again?
Yeah, it wasn't too hard. I get excited easily.
Yeah, which is good for a cheerleader.
It doesn't take much. It didn't work, and I don't think I was too heartbroken. I tried my best, and I got lucky. My principal knew that I was passionate about healthcare. He knew that's something that I wanted to pursue, and then I would do a good job, and I would try my hardest to get this up and running for future students. So when he did give me that call, it was like, okay, awesome, second try. You know, this second try, I had some of my closest friends with me who are all still in healthcare now. We all are in our own avenues.
That's great.
We're all really close to, one of my friends she's a CNA, she's going to school to be a nurse, and 2 others are in healthcare administration. We have a dental hygienist in our friend group. So we're all still passionate. We all still promote these values, not necessarily Ribault Get Raw, but for me, it looks like Crown of Health. For some of my friends, it looks a little different.
And I love that you've surrounded yourself with a friend group that has some of the same interests, and it sounds like the same motivation to get going. So how important is that?
Very, very, very. I'm very grateful for my friend group. We push each other. I've been pushing them to go back to school and get their masters. They push me to keep working hard, so hopefully I can win Miss Florida this year. Very supportive friend group, and I think together we would not have been able to make Ribault Get Raw, or without each other, we would not have been able to make Ribault Get Raw as successful as it is today.
Now, who do you credit? Because high school is like a jungle, you know? It's so easy. I got a high schooler. It's so easy to just see something and kind of go off on a tangent, or get caught up with the wrong crowd, or the cool people who may not be doing the right thing. So what do you credit for keeping you on the right track?
I don't know. Probably my mom. I think that goes back to the foundation, because it never came to mind to veer off. I think it goes back to a foundation that wasn't an idea for me. I wanted to continue to do things like create Ribault Get Raw. It wasn't like my parents were like, you need to go get an internship. You need to go do this. It started from the foundation. Like, Paris, you want a good job, you have to work for it. You have to stand out. How are you going to stand out? And I think I always think of ways to help myself stand out from my peers, essentially.
Shout out to mom.
Shout out to mom.
And on top of all this, you are actually going back and trying to help other kids who are, coming up behind you. There's always another generation. So how are you doing that? I think I'm looking at this over here. What is this? Is this yours?
It is.
This is your book.
It's my book, The Not So Perfect Garden Project.
I'm gonna grab it.
Okay. This is the very first copy. Very first copy.
Tell me about this.
So this is for Crown of Health. It's through my platform.
Okay.
I wanted to kind of get an introduction for younger students to get involved with health equity and health disparities and food insecurities. And I thought the best way to get started was to talk about gardening. So the Not So Perfect Garden Project is based off of my mentees, Lauren and Joy. So this is Lauren. I'll show you Joy. Lauren and Joy.
That's great.
Funny story, their moms were actually my high school coaches and are the reason I am a UF cheerleader today. So everything is so full circle. They were my coaches at Ribault. I think this is a great way to show students how to get involved, again, with their health, with their overall wellness and well-being. They might not be able to start a Ribault Get Raw in elementary school, but you can help push, administrators. Maybe we can have a school garden or a community garden in our neighborhood. That's something a little bit more obtainable for this age group. I'm thinking babies, younger students for sure. I would probably say age 6 to maybe 10, 12.
The concept of starting a garden.
Yes.
Okay.
This is for our younger kids.
All right. So, book.
Yes.
Author. Getting your master's degree. What is in your future? What do you want to do ultimately?
I want to be the CEO of a hospital. That is my complete end goal. Yes. And then from there, I would like to get back into maybe more philanthropy, looking into health equity, maybe expanding Crown of Health across the state of Florida. I want to continue this past Miss Florida, past going into healthcare administration, because I think it is something that's not only going to help my career, it's a passion of mine. I think it's something that kind of helps me calm down or relax almost.
Which part helps you relax?
Crown of Health.
Okay,
yes.
Which is still a whole lot of doing. So I'm trying to put the two together. You have a ton of energy, and I think it's so important that people understand, even though it sounds like you have been marching forward, you've had setbacks, you tried to run for
Miss UF.
Miss UF.
And I didn't make it on my first try, and I went back again and I made it. I wasn't able to become a UF cheerleader on my first try. I tried for an organization that I wanted to be a part of, Florida Blue Key, 3 times before I was able to get it. And on my 3rd time, I was appointed outreach chair. Unanimously. So I've had a lot of times where I've been told no, and I kind of like it. It's weird. I kind of like being told no.
Why?
Almost, it makes me want it more. It's like a fire. Like, oh, okay, well, now I'm gonna get it.
I see. It's because somebody's telling you can't do it. You're like, oh yeah?
Watch.
Wow.
I'm gonna try my hardest to make sure that I can get it, yes.
Which is pretty awesome. Well, Paris Richardson, thank you so much for sharing. And I'm sure your story is just going to motivate young people all over our area. And good luck
with
the Miss Florida contest.
Thank you, Joy. Thank you. I'm excited.